Welcome. This is the Aurora Health Alliance Access to Specialty Care interest group. We cover a variety of things when it comes to access to specialty care, but we specifically are interested in creating better access in Aurora for specialty care and the role that the Aurora Health Alliance can have in achieving that. In terms of our agenda, we're going to really focus in on two things. The first being a review of the access to specialty care, a survey and assessment that was completed this last year. But we now have those survey results and they've been shared within our access to specialty care work group. How do we want to go about disseminating those out to a wider audience is really the question today, and consolidating that information. So some of the folks within the Aurora Health Alliance staff and board members, as well as partnering with those that put the survey together, have really tried to consolidate down the information into what was originally a one-pager, is now a two-pager, to kind of outline really what the findings of that survey were, and what would be hopefully some next steps in honing in on some areas of specialty where we're hearing from the community there's challenges with access. So Rich, I'll turn it over to you to talk a little bit more about the survey.
Well, thanks, Heather, and thanks for everyone being here today. This has just kind of been it has been a big focus of the Aurora Health Alliance for a long time, specialty care. Not a surprise. I think everyone looking at the people here know that specialty care is an issue in Aurora, Denver, Colorado, the country. But we specifically wanted to see what was happening, the nature of the beast within Aurora, and talk about what some possible solutions will be. So as Heather said, the Department of Family Medicine, Dr. Mader, who's a family physician at A.F. Williams now, and I think a leader in many areas in the School of Medicine, followed up to the 2019 Colorado Health Institute report on Colorado specialty care, and again focused on Aurora and the issues in Aurora, and what they came up with, and you see the part of the two-pager we have is no surprise. There aren't any surprises in there, I think, for anybody. The top unmet needs for Medicaid and uninsured when it comes to specialty care in Aurora are like neurology, rheumatology, psychiatry, urology, endocrinology. Basically, those are the top ones, but every specialty care has an issue. So I won't get into details of that. I mean, it's not a surprise, but what I just want to talk about before we go to phase 2 of this discussion and getting HCPF involved is what are the possible solutions? And we all know that e-consults and echo e-consults and are part of the solution. But we wanted to kind of focus on within Aurora what is a fundamental recommendation that came out of this. And basically the needs assessment identified something, again, that we all know: the system is broken. It's not functioning as a system for individual patients or for providers who are trying to refer patients. Issues are complex and require a complex solution, and that's probably why this issue has been around us forever. Certainly since AHA has been, and years before that, since AHA was around. Some of the specific comments that came were that that we all need to be involved. HCPF, the Medicaid folks, UC Health, Medical Center of Aurora, and the other hospital providers, Aurora Mental Health, you know, they're all part of the solution. We need to work together on that. People tend to want to focus just on UC Health, but you know, it's the whole shebang. Denver Health is certainly partners in this too. Basically, individuals and teams on the ground are struggling providing care for their patients. No surprise, specialists don't accept Medicaid and uninsured patients. For those that do accept Medicaid or uninsured patients, there's limited access. The current specialty care environment is unnecessarily complex and challenging to understand and navigate. Certainly it would be almost impossible for individuals to get their own specialty care using Medicaid. But for providers and care managers, it is just tremendously complex for them too. And that's may or may not be a surprise. I think that those of you who are close to work in clinic environments, it is not a surprise. For specialists that accept Medicaid, there's a cap on the number that limits access. The cap was noted multiple times in this study to be confusing and a lack of transparency, the lack of knowing who accepts Medicaid makes it hard for providers to care for their patients. Being transparent about Medicaid access and developing a central tool for care managers and providers to reference to see if someone is accepting Medicaid at this time is something that is going to be needed. In other words, a transparent network map. We just don't have it here in Aurora or even elsewhere. I think Doctors Care used to have one, but I think they're challenged to have one now too. So that would be creating a collective list of the network of what is available for Medicaid and uninsured patients. We can't forget about them. And then work with individual specialists and our institutional partners, our hospital systems, Aurora Mental Health and so forth, to ensure that capacity and policies underlying what they're able to take and when are there. So and that would take, to develop this network, a dedicated staff. It can't just be by volunteers or one or two care managers volunteering. It will probably take a dedicated staff. And how do you pay for stuff like that? I don't know. Maybe at the end we can talk about how can we get a transparent Medicaid access network map that doesn't exist right now. How should we go about it? And that is what I think greatly relieved the burden that's on family care and primary care providers who try to do a step up in referring their patients beyond what they can do with e-consults, but actually get their patients into a neurologist or a rheumatologist and not have to make dozens of calls and just reach lots of dead ends. And that's our primary care providers, even our emergency care managers. This would be very helpful for them because a lot of people do get their care in the emergency room and then get a referral. And those of you who are close to the care management environment, the various clinics and care managers and providers have their own secret list, as Molly Market says, their own Rolodex going back, and they don't want to share it with people because they want to make sure that they keep it privileged so their patients can get referrals. And that's not a good system to have. So that to us here in AHA is a fundamental recommendation that we would like to focus and work on. Now HCPF, though, we have Lauren and Devin here, have something that they're working on that I'd like them to talk a little bit about. It's not the ultimate solution because PICPUF can only use the data that it has, and it doesn't know from one day to the next who has Medicaid, but it does know what the history of Medicaid is, who submits their reimbursables to them. And so they have a project underway that we'd like them to talk to us a little bit about, that could perhaps provide a specialty care access tool that could be merged into Find a Doctor, the online app to find a doctor, and maybe solidify that, because now if you go to Find a Doctor, it says yes, accept Medicaid, but if you call them, oh, but we don't accept them now. We don't have any openings. This wouldn't necessarily resolve that. We need that transparent map, but at least it's a step in the right direction. So with that, if
Hey,
it's
Rich,
okay,
before we
go ahead.
go on to the next agenda item, I know that Clayton's on. Clayton, I think that you were a part of assisting with developing and working on this survey, and just wanted to give you an opportunity if there's anything you wanted to add.
Hey, thanks for the shout out. Yeah, for anybody that doesn't know, my name's Clay. I'm a fourth year medical student that worked with Dr. Mader on this project. I fortunately had the time today to step away from my school stuff and hop on here. I really wanted to kind of see how the whole group received everything and sort of what the plan was as far as like next steps going forward with the data. And I think that this 2-page summary is about as broad as an overview as we could get, right? I think taking things one step at a time, trying to target the lowest things on the totem pole as far as being really transparent, and these options of trying to get everybody on the same page is exactly what's needed to be done as far as getting things rolling in the right direction. You know, when you really get into the meat of this survey, there were tons and tons more very specific recommendations about either certain specialties or, one thing that one person experienced one time. And it's kind of hard to sift through all that data and come away with a big recommendation that we can target. And I think what Dr. Bader and the rest of the team has come up with has been a really good first step and good idea. And I'm excited to see what everybody else thinks about things. And I'd be happy to clarify or answer any questions that people had about the logistics of the survey, or possibly how things were gathered or assessed. So thank you for having me.
Thanks, Clayton. I didn't realize you were on the team. We should have had you lead off on it. But thanks a lot.
No, it's okay. Like I said, I wanted to be here and just kind of see how the survey worked once we actually put it out, and not just coming from us, the ones who created it.
I think overall it was very, very well received. It was great. Carrie had the foresight to Dr. Mader to video to record the Zoom where she walked through the survey and went through her slide deck, and I have shared that over and over and over again, just so people can really dive into more of the meat of the logic behind it, the methods that were used to capture the information. Because it was just the quantitative. What was really interesting also was to hear all the qualitative, the comments. Those were really rich to read through and just get a better understanding of trends on what we're hearing. And I also think it's nice to have some key takeaways and call to action that were very clear, and it really helps drive this group forward in what we can do as an alliance. So overall, I think it's been very well received. Mandy, I see your hand up.
Thanks. I just wanted to point out for Clay and for the rest of the group, there are several representatives at this meeting that were a part of the Kaiser Ascent cohort focused on specialty care. So I was just curious, we plan to share this with that group who committed, I think, to continue to meet quarterly, and see if there in the future is any partnership opportunities, especially with Kaiser. So not looking for a commitment. I just wanted to highlight that we are continuing to elevate this work throughout the metro area. So thank you.
I had a quick question. Because
Speaking of,
yes, so my name is Vicente Cardona from High Health Alliance, and we're doing a lot of the kind of the same work right here in where we're trying to collect a list of specialists that actually accept Medicaid and uninsured patients, and so there is issues there across the state. But I'm kind of curious as to the transparent network map. What does that mean? Is it kind of connected to that collective list in terms of the recommendation, or is it something totally different? I'm trying to get a better understanding of what that looks like.
Thanks, Vicente. It really is the map of who accepts Medicaid today. Transparent. We say it's transparent. It's because providers, care managers in Aurora, other parts of the metro area, they have no clue who does, and they may have their own private list, or they go to find a doctor or some online site, and they wind up making tons of calls, going into rabbit holes because they just can't find who will accept Medicaid in their area. So it's making, I think, transparent. You could say making Medicaid access transparent, especially to care managers and providers.
Thank you, Rich. I appreciate that. Yeah, I feel like there's contracts that are always being renewed every year or every other year, and so that kind of makes things a little bit difficult on both for HCPF sides and just any type of referral list, because it's like one year they will accept Medicaid patients and uninsured, and sometimes other years they won't. So it's really hard. It would be interesting to see if there'd be a system in which it's kind of continuously updated, but I feel like that's a little bit above my pay grade.
But it's a wonderful idea, with technology and in the right pathways. Something like that would just be wonderful, and it would really help reduce this big Medicaid issue that providers are just lost out there as to who will actually accept a neurology patient or an endocrinology patient, and it shouldn't be every clinic has its own secret list. We should step up and be better than that. So have a better system than that. Are we ready to go to Devin?
Any other questions or comments or feedback on the survey itself, or on what the Aurora Health Alliance has put together in terms of the 2-pager?
Hi, this is Serenity Young. I'm a member outreach coordinator with DentaQuest, and we oversee the oral health and dental benefits for Medicaid. And not surprisingly, there are a lot of parallel challenges that we face on the oral health side in terms of being able to maintain an adequate list that is out there for members and also care providers and for the care managers for who's taking Medicaid. I think there are some existing tools. I know for certain on the dental side, we have a Find a Dentist tool, but our information is only as current as the information we get from the providers. And so I'm working hard to try to see if we can to streamline the way for them to be able to get information to us so that we can do some real-time edits directly into our provider directory. I think really leveraging some technology might be a good first step to morph and to tweak some of the existing tools that the department has. I know there's a Find a Provider tool on the HCPF site, but it can be woefully out of date because unless the provider is letting us know that they're no longer taking Medicaid client patients, then they're going to still continue to be on that list. So that was just my 2 cents. We're working on that on the oral health side too, only because, I know providers don't want to have frustrated patients showing up saying, hey, I thought you were taking Medicaid. So I think it behooves both the providers and obviously HCPF and the members to maintain adequate network lists.
Thanks, Aroni. I appreciate the insight that you have when it comes to dentistry and your need and within your specialty of finding, knowing and being able to loop into Medicaid providers when specialty care is needed, regardless of whether it's dental or some other. So you just really underscored that need. And to me, I mean, I'm a simple guy out in the community living in zip code 80010. Why couldn't we fund someone whose job is, that's all this person does is daily go out and survey the specialty providers. Hey, you accepting Medicaid type of thing. And specialty providers might be reluctant to be part of it, but maybe we can help them become part of this network system in which the centralized person does queries daily to check who's accepting Medicaid and who's not, and what the parameters around the acceptance might be. So something like that, I think, would be good, and it would take an investment of resources to do that. This is not being done now. And smaller scales, at one time, El Paso County maybe was doing it, Doctors Care maybe does it to some degree, have to DD on it. But we're looking about a broad and expansive system so that within our Metro Denver area, at least, a big part of the Aurora, a big part in Denver, that providers will know fairly reliably as to who that endocrinologist is that might be accepting Medicaid. Maybe it's a pipe dream, but it's something that really seems to be a solution that we can work on that would really relieve the burden that's on the providers out there right now. Okay, that's my 2 cents.
This is Tina. One thing we might want to think about, kind of in that theme, but maybe going a next step forward, is I think there would be more, and I'm speaking. I know how we manage Medicaid, and certainly we see a lot of Medicaid, but that doesn't mean you can call every day and get like a new patient can call and make an appointment. And so I suspect it's the same with our community specialists also, that there may be ways for Medicaid patients to be seen, but it may not be with them just calling and making a cold call. But I think one of the barriers that we have right now is everybody from a specialist standpoint being worried about saying if I'll take one, that I'm going to have to take all, and being flooded. And so if we're going to invest in a resource that would look at that would just survey, why don't we consider a resource that would coordinate the referrals in a way that then there was confidence among the specialists that they weren't getting all the asks. And I think that's kind of what BB and Doctors Care does with their specialists is, they say, how many can you take? And then they make sure that they don't go beyond that. And that way the specialist feels confident that they're a part of a system, that they aren't the only one. I think that's, when we talk about the system, it's the specialists also who feel like they're not part of a specialist system that would equitably distribute the opportunity to care for these patients. So, but I think there was the GI group in Boulder did that amongst all the community GI doctors, I'm told. So that's a model we could look at, but it would take significant investment, and I think it would need to be done by sort of a third party, someone that could come in and be a objective voice in that discussion.
Thanks, Tina. That really is the Doctors Care model. BB was saying there's some barriers to that now in modern times. So when I say modern times, 2019, 2015, that seemed to work well. Now there's some challenges, but we can get into
Well,
that.
there are, but this may be a way to help overcome those challenges. When I've talked to her, and I don't know what all of her challenges are, but I know that one of the big challenges is that the people that used to be in private practice, and so you could have a personal relationship with, are being acquired by private equity. And so you have private equity right now, particularly in urology, dermatology, and those, it's now shareholders who are saying whether you can or can't see Medicaid. And so again, you in that setting, we might be able to make a argument by saying, hey, everybody in your community is doing this and you need to pitch in, because right now they can just say, we're shareholders and we don't see patients who don't pay enough.
Exactly.
Yeah, I do think it takes that coordination. It's not just having an updated list, because that doesn't always feel actionable. It's, yes, there's this list. It doesn't mean that anything happens with that list. So even though, you might call an endocrinologist and they say, yes, we are taking Medicaid, that doesn't always mean that the coordination on the back end is happening to ensure that individual gets there. So I like the idea of trying to figure out a way to resource the coordination component. That's what it feels like is lacking. And we did have a student, Maida, who was just looking at neurology access within Aurora, as that came up as the top need for Medicaid members. And a lot of it is robotic. So you call, it's hard to get a live person. And so for someone cold calling in, there's a lot to navigate in terms of trying to coordinate and get that appointment. So to have somebody to help with that piece to ensure that someone can get that access, I think will be crucial as we plan moving forward. Well, thank you, Clay. We really appreciate you joining and ensuring that you were able to give some context and some background to the work that you did on the survey. The Aurora Health Alliance really appreciates the work that you did and helping ensure that the survey was a success. You were able to collect all the great data. So thank you so much for that. And if there's other feedback regarding the 2-pager, if you feel like we missed something, or it'd be great to have an additional component, feel free to drop that in the chat or reach out directly to Mandy, or I guess Bobby Joe would be the 2 best contacts for feedback regarding the 2-pager. Our hope is to try to get that out to the community this summer so people can, quickly look through the findings. And then if they're interested, they can always do a deeper dive and we can send out the more robust slide deck or the video that Dr. Mader put together.
Perfect. Thank you so much.
So the next item on the agenda, we'll turn it over to Devin, who's going to talk a little bit more about a specialty care data set that HCPF, Healthcare Policy and Finance, trying to be better about my acronyms, is currently working on. So Devin, I'll turn it over to you.
Thanks, Heather. Hi, everyone. I think I knew most of you all, but nice to meet you. My name is Devin Miller. Work over at HCPF, and I have a couple other colleagues that have also joined the call. Just wanted to provide an update on what we're doing internally over at HCPF regarding specialty care provider data. As I've mentioned probably in other meetings, it's been historically challenging on our end to identify specialty care providers within our data. So we've been working with our data team to clean up that process to better identify specialty care providers and creating a more accurate list of providers accepting Medicaid. Right now, we're still in the process of fine-tuning it, but hopefully having at least a list or kind of a tool, we've been calling it, to be able to share externally with partners, knowing that it's not the end-all be-all as we've discussed, just having a list, but at least from our end, being able to provide more of a transparent, like up-to-date Medicaid list of providers within specialty care that we are building in filters that will show Medicaid providers with active contracts, Medicaid providers that have billed Medicaid in the last 12 months, if they have telehealth capabilities, if they're, you know, pediatric only practice, adult only practice. So trying to kind of fine tune that list. We presented a couple of weeks ago to the Rays to get feedback and understand their process for, you know, what list do they go off of? Do they have their own list? What would be helpful to them? So gathered some really great feedback from that group. And then in, I think, June 15th, we'll be presenting this list internally to our Medicaid operations division, which oversees a lot of the member services side of things, but then also the provider services side of things. So we're really hoping with this cleaner list to do some external sharing to our partners and care coordinators across the state, but then also internally looking at, okay, who are all the providers that at some point have billed Medicaid, are enrolled Medicaid providers, but maybe not seeing Medicaid members anymore or haven't seen them in the last year. And hopefully providing a little bit more provider outreach and engagement from the HCPF side. So just a brief update on that. Open to share any more information, or if you have any thoughts on what would be helpful for this group or from the provider lens, as we're still fine tuning all of that.
So Devin, you said that you hopefully by the middle of this month, you would have something for, would it be just internally within the HCPF teams or throughout there for care for providers throughout the Colorado?
I think before we externally share anything, we want to make sure we're, you know, the tool is useful to whoever we share it with and is included the information that's needed. So I'm hoping maybe by the end of June, we'd have something to be able to share externally. Definitely open. I know presented it in other work group meetings, but can share out kind of high level what this looks like, and if we're missing anything that, you know, your organization would benefit from. I'm glad, DentaQuest, thanks for your thoughts kind of on these provider lists. We've internally discussed on how to kind of do this with dental as well. So, and the meeting on the 15th is also with some of the folks who oversee our kind of Find Our Provider tool. And I have done some kind of like comparison on, I'm not sure the methodology that they're using to pull those providers, but we're hoping with this cleaner methodology, we'd have better updates for the My Provider tool. So hoping to kind of standardize this process across the department, which sounds easy, but has been kind of challenging with the different areas of specialty care and different provider groups. So definitely open to feedback, and I'm happy to share anything with the group. We want to make this as useful as possible to all. So, yeah.
Devin, could you maybe give an example of like how you could see it being utilized?
Sure. So specifically with our Rays, because that I think was maybe one of the main drivers for this, is our care coordination teams with the Rays. So it would be a list of all providers in the state. They can definitely filter by Ray and geographic region, but it would be open to all, you know, anyone would be able to see the providers throughout the state. And then being able to zone in and understand, kind of just have a more accurate list. You know, if you needed a patient who needed to go to a urologist and you lived in this one county, you could filter, see that list of urologists that have actively accepted Medicaid in the last year, and hopefully just use it as a cleaner process. So it's not just a more updated list, I would say. And I think hopefully it's helpful with the filter of they've actively seen Medicaid in the last 12 months, because as we've mentioned on this call, like that changes. And I know it definitely doesn't get to the heart of a lot of the care coordination pieces where that number changes throughout the year, that changes throughout the month and the week. So, but at least a starting point for that. But open to any feedback, please, from this group if you have any additional thoughts.
So Devin, what I've seen is the app on the internet called Find a Doctor, which is and it always says that they've accept Medicaid, but it's probably not very reliable. There are some questions as to how frequently that is kept up to date. But I think what you're saying is maybe by sometime this year, or by the end of June, we're talking about a complicated application. but that application can then reflect the data that you're extracting and filtering. Is that right? That's what the provider or the care managers could use besides their own little Rolodexes.
Yep. Yep, that's the goal. And I mean, from experience using that tool, it's also not the friendliest tool. And that, again, kind of out of my wheelhouse, but I think, from being a care coordinator in a previous life, I think even having just an Excel doc that you can easily filter through, and you're not trying to go on the map and look through that, but and being able to put your own notes in. So that's what we're hoping to kind of share with this kind of provider Excel doc tool.
Devin, this is Sarah Young again with DentaQuest. Thank you for including and thinking about oral health as part of whole body health and also access to specialty care. Recently, is probably within the past year, they're just two different credentialing processes to be a DentaQuest provider and a Medicaid provider. And so if there's anything we can do to contribute to the conversation, because I think to have multiple doors for people to be able to look for providers, not only on our website, but to look for dentists on your website would be fantastic, and how we can integrate the credentialing process so that we can let you know who our providers are, since they can be both credentialed with Medicaid and with DentaQuest.
Perfect. That sounds great. Thank you for that.
I have a request, I guess. This is so exciting moving forward. Thank you so much for being collaborative with us and keeping us updated about this. I guess my request is just, once it does go live, is there like a built-in, or could there be a built-in way in which care coordinators can provide feedback? Well, one, testing with care coordinators to get their feedback before it goes live, and an ongoing process to gather feedback so that it doesn't become, another tool on the website that people don't use because of XYZ. And if we can help facilitate any of that, please let us know.
Yeah, that's a really great point. And I think it will, thinking about the sustainability of this, so it doesn't just become this outdated list, but how often are we updating it? How are we communicating out new lists? Will definitely be built in kind of our workflow moving forward. So I appreciate those thoughts.
Yeah, I had a question. And I really love this, as everyone has mentioned, bringing everyone to the table to kind of bring in and share ideas, especially something along the lines of like an Excel spreadsheet. I think sometimes I think of something in my mind, but I don't think this would be feasible if like we can all kind of work together and be like, hey, you know what, this care coordinator's saying, hey, you know what, this physician actually isn't taking Medicaid, and just put like a little reminder. And so when people are kind of looking through it, someone like the Rays or something along the lines of, and saying, hey, you know what, I've already reached out to this, they're not accepting it. And it's like, if you want to double check in like 2 months and double check to see, great. That way it's a kind of always updated system. But that's one way of, in an ideal kind of world and all of us kind of collaborating. But one question that I did have is, how are you, I know cleaning up data is time consuming. I've definitely done my fair share of that in my day. But what kind of verification are you asking these physicians to ensure or to double check that they're taking Medicaid or seeing uninsured patients?
So right now, what we have built in is just if they've actually billed Medicaid. And I think we've talked in previous work groups too, where, sometimes that might not be capturing everyone. But at least we'd be going off of something that like is more concrete, defined, like they actually saw Medicaid, they billed Medicaid, being able to identify them that way. And your thought on the updated list is something we've definitely explored, of like having a live copy of this. I think in a collaborative group like this, it definitely makes sense, but I think there was some hesitation raised by other individuals that it might be like, well, it still goes back to what Rich was saying, where it's like, well, I'm not going to share with you who I found is actually accepting Medicaid. But and maybe it's, within each ray, they have a live copy that they update, and you say, hey, I called them on June 2nd. They're not taking Medicaid. Maybe we check back in 30 days. We've explored opportunities like that. And maybe we start with like just presenting the tool, and whether it's a ray or a care coordination organization can kind of use it in their own way, where maybe they do put it in a live version that can continually be updated by their care team. Open to thoughts on that, but I think it might get a little tricky.
Yeah, and that's what I was thinking as well, where it could potentially, ideally it could be something really useful, but realistically, if I was a care coordinator, I'd be like, unfortunately, I don't want to share my resources with you. I do agree that sharing amongst specific rays will be okay. But I think once you get into bigger cities, because Aurora is still a big city, and Denver is still a big city, and Boulder, but somewhere outside, I think that the smaller cities, I think they would be probably more inclined to share, right? But yeah, that's just my opinion. But again, thank you for the work. I know this is so difficult. I feel like this is a never-ending challenge. So I really do appreciate you always coming to the table and having a conversation.
Yeah, thank you for your thoughts.
And that issue of the reluctance to share and having secret lists could still be there, but then we go to Tina's suggestion, which is would be complicated in itself, how we could get around that if we actually had a central point that did the coordination with specialists. So someone in Boulder, or someone in Parker, or someone in Aurora, or someone in Denver, neurologists would be able to go to the specialist who's in line, is not going to be swamped, but next batter up is this guy in Parker within 10 miles of where you live, and he or she is accepting neurology patients. Again, it's the old doctor's care model that certainly has worked for them. Some barriers now, as Tina noted, but it's something we need to probably keep in mind as to what what we're talking about is a solution, but this is an enhanced solution, multiplied 100 times, I think. I'm not quite sure how we get that off the ground, but all of you guys maybe could be in on helping to get it on something like that off the ground, at least in strategy.
Great, thank you. Yeah, it's very, very exciting, Devin. We've never had anything like this. So just to know that it's on the horizon, it's something that's being developed on the HCPF side is really exciting. And I'm hoping you can kind of bring us along in a collaborative way as it begins to evolve, and how we can also get the word out. And I don't know if there's a plan just for how it's expanded. It sounds like it's starting more with the rays, but as it goes to community providers, and how we can ensure that there's that bi-directional feedback loop on what's working with it. And, if there are providers, to Vicente's point, that might have billed in the last year, but have stopped seeing, there's a way for us to kind of note that and keep the list as up to date as possible.
Absolutely.
Well, great. Well, this is the point in the meeting where we kind of open it up. And if there's other announcements or activity that anybody else would like to share on the Zoom related to access to specialty care, now is your chance.
I just have a quick share. Dana Chang is joining us, and she is new to HCPF, and she was brought on as our e-consult evaluation specialist. So as we're moving forward with developing and finding a vendor for our statewide platform. Dana will be helping to design the evaluation strategy. I don't know if you want to say hi, Dana.
Hi, I'm Dana. Nice to meet everyone.
And Devin, you had talked about this earlier at one of our prior meetings, that this is a first in the country type of deal in the state, right?
First in the country to have a statewide platform, correct?
When do you think, just more of a curious question, when do you think we'll kind of hear about when the vendor is selected? In a couple months? I don't know, I'm kind of curious.
Yeah, absolutely. And I can share out kind of our link in a minute too for the kind of our external website. But received proposals. We were in the process of kind of going through those, and then we'll go into negotiations with vendors. I think hopefully by the end of this year, so in December, January, having a vendor, then it'll be a couple of months of kind of standing up that contract with the vendor. So hoping to go live summer, fall of next year.
And Devin, has there been progress on the reimbursement model for the providers?
So due to CMS restrictions on how we can reimburse for e-consults, we're kind of doing this like wraparound payment model where we're paying through the vendor. So we will be reimbursing primary and specialty care.
Okay, through the vendor though?
Yep.
Okay.
Welcome. We're glad you're here, Dana. This group loves talking about e-consults. It's another innovative way for us to create better access to care. So we're very glad to have you and hope that you can participate in future meetings.
Yes, thank you.
And I wonder so Dana will be building out, the evaluation strategy over the next couple months. And maybe using this meeting to, we're trying to look at it, Dana is kind of really charged with demonstrating success of the program and what that means for the payer. So what it means for Medicaid, what it means for members, what it means for providers. So trying to break out that evaluation strategy in those different buckets. But would also maybe love to use this group in a future meeting to understand, from the patient perspective, from the provider perspective, what would be helpful in kind of demonstrating that success and how we can be looking at that from a state lens. And I know we've worked with CU a lot in understanding with their extensive program for e-consults, but would also love to, open it up to this group. I think specifically also from the patient perspective and what would be meaningful. So yeah, maybe just as an idea.
Great. Absolutely. We can use this group as an opportunity to gather and inform that evaluation.
The metro area health alliances have been involved in planning community outreach for the renewal, the requirement that people receiving Health First Colorado benefits renew and re-enroll so that they don't get dropped at the end of the public health emergency. And that obviously touches on this discussion, because if all of those people that are wanting to get specialty care appointments and they're on Medicaid, they need to continue to be on Medicaid. So the alliances are working on that throughout the metro area. And it is a big lift. I know Colorado Access is working on it as well for this region. So look for updates in the Aurora Health Alliance newsletter for that.
Well, thank you, everyone. Great meeting. Again, if you have feedback regarding the survey, questions, comments, concerns, kudos, send those along to Mandy. I believe she dropped her email in the chat. Whether it's a larger survey or the 2-pager, we're hoping to get that out fairly soon. And then thank you to HCPF, Devin, and team on presenting what will be happening next with the specialty care data tool. Very exciting. And Devin, if I don't know if people have access to your email, or you can go through Mandy if people have follow-up questions regarding that process. They can go through the Alliance or get in contact directly with Devin. If there's no other comments, questions, hopefully we can go ahead and adjourn here 4 minutes early. That's rare with this group. And hope everyone enjoys their summer. Hopefully you can get some sunshine today. Bye, everyone.